Hello and welcome again to Doctors of Courage podcast. This is part two with Dr. Shivra Akula of Louisiana. And welcome back, Dr. Akula. We thank you again for continuing your discussion of the case against you in Louisiana. Dr. Akula is a infectious disease specialist, and he also owns a hospice organization that has 4 locations, 3 in Louisiana and 1 in Mississippi. And he is one of the latest doctors to be attacked by the government for being a successful, compassionate physician in an area of where a lot of the people that he serves are the less fortunate folks in America. And he's the kind of doctor that's being targeted across the United States. So we just hopefully can show him as an example of what the government is doing to our compassionate physicians in this country. And welcome again, Dr. Akula, to the part 2. And part 2, we want to pick up a little bit with a little bit more explanation from part 1 as to the paper trail that basically the government laid against you in the past, so that it would be something that they could be reflected against you now, that they simply, as soon as one was over, they picked up and charged you with a crime, even though you thought the first time that everything would be cool and over with. I know that's basically the same thing that happened to me. And so I can relate to your situation. So kind of go back again and explain the paper trail that the government set for you then back during the time of the Katrina situation and so on, if you would, or pick up wherever you want to look, where you feel comfortable. Just go ahead and begin again.
Actually, you're right there. I think, several people asked me what may have been the origin of this investigation and indictment. So I think, this is the way that I put in. And as a successful, Indian doctor that came with $50 in my pocket, I had only one, thing in my mind, and that was to serve this community. And this exactly was the reason why during Katrina, all hospices left because they were not able to make money. And they could not conform to the Medicare regulations. There are 2 regulations that the Medicare wants for every hospice. One of them is 80-20, which is for every 20 inpatients, you got to have 80 outpatients. There's no outpatient, it's all flooded. So we could not conform to that. That's number one. Then there's an annual cap. For every patient, there's a certain dollar amount that you got to multiply by the number of patients you have. So this 80-20 is something that we could not conform. So we told them. And the CMS has sent the representative to us. You're doing great. Keep up the good job. We're going to flex the Medicare rules for y'all. And in fact, Congress passed a bill altering the Medicare regulations for the people or providers in the area that's affected by the Katrina. But at the end of the day, they came up with some excuse or other. And after a year or 2 years later, we start getting notices saying that, no, you have overpayment. And I said, well, what did you do? Then they say, well, you did not conform to 80-20. I said, we already told you. We're not going to be able to conform to 80-20. But at the end of the day, for the last 4 years between 2003 to 2007, they raked up $2.4 million as the penalty. And so our lawyer fought very hard, and we won a lot of appeals. And the government evidently has the final say in overturning. And they overturned every appeal that was successful, on our part. So finally, we actually had to file a suit in the Louisiana Supreme Court. Few days before the trial, we were offered settlement. We were paid $746,000 as a part of settlement out of $2.4 million we paid. That we should have been paid because we were told, we were lied that we're going to take care of you. Don't worry about the Medicare 80-20 rule. And that was not true. And we paid a price for that. So it was in 2012 that this settlement was done. And somebody already pointed out That's a whopping amount of settlements the government is giving back to you. You better watch out. And it's exactly what happened. Right after that, I've been getting like 30 charts, 40 chart audits, 99 chart audits. They don't want to say 100. So hundreds of charts audits, which is very discriminatory and targeted
I
to
have a
zoom.
question. I have a question for you about that. Did they by chance always ask for those charts in January? Or was it spread out across the year?
It's there again, I was told. In fact, as a matter of fact, I have a suspicion they went after some of the disgruntled employees and
Uh,
saw some of the charts which potentially could be an easy thing for them.
yeah.
Because could you imagine, we have served thousands of patients. So there's going to be a very small portions that may or may not conform to some of the regulations that they immediately zapped it.
Yeah, I
And
know before my first attack, when they came after me, the Medicare did the same thing, and Medicaid was they asked for chart reviews 3 years in a row, always in January, which of course for a family practice physician, that's your busiest month because that's when everybody's sick. And how are you
uh,
supposed to gather these charts around and and make copies of them and get them turned off to Medicare? But it was, and I actually queried Medicare. I said, why are you coming after me every year now and asking for a chart review? And their reply was, oh, we just do it a random pick. It just happens to be that you just happen to be picked 3 times.
you're
It's not,
lucky.
it's not random. It's not
Lucky.
random. They're targeted you. Doctors have to recognize the fact that when they start asking for chart audits, you are
They're
in the
targeted.
in the target. Yeah.
Absolutely.
Okay.
It's a bull that
Yep.
they want to shoot you and they want to
Yes.
bring you down. That's exactly what they did. And so for
And
3 years,
their review people don't even have a usually don't even have a college education, and
I
they're
was,
paid based on how many charts they say do not comply with the rules, and so that they get their money back from you. Yes.
in fact, as a matter of fact, to just expand on that, in the doctor's lounge, where the doctors used to tell me a ZPAC audit has got a commission where if they save $100,000, they get certain commission. So they had absolutely no reason to even
Yeah,
pass any of those chart audits.
exactly.
They
Yeah.
have every reason to make money out of those audits, and that's
Yeah.
exactly what they did. So the biggest audit was 99 chart audit, and it's almost like 100, but they don't want to say 100. So otherwise it'll be hundreds and charts. So out of the 99 charts, they denied every bit of it.
Gee,
All
imagine
charts.
that.
As if we have never done any service. Could you imagine? We are a 20 years, 2 decades service, Joint Commission accredited hospice. There's not a lot of Joint Commission accredited hospice in town here. And a Joint Commission accredited hospice is like a seal of a standard of hospice care. And for somebody like that, you denied 100% of 99 charts. That obviously shows there's something wrong. So that's ruthless how they were. And it is so happened, my guy, our lawyer, I was all excited that, oh yeah, he's going to fight it. We're going to get back. Guess what? When it almost came to filing the appeal, we were almost getting close to the deadline. He said, Doc, I'm afraid I cannot represent you. I said, what happened? Les, what happened? He said, oh, no, no, no. The prosecutor is trying to do something and not trying to put him in trouble. So whatever the legal measures that were done to scare him off, I had absolutely no other choice than to just pay it back.
Mm-hmm.
I ended up paying nearly $400,000 for lack of representation and an opportunity to appeal. Because
Prosecutions that use threats and like we'll put you in prison for this and this. I mean, to me, this should be illegal and should be against the law, and those prosecutors should be sitting in prison cells, not us compassionate physicians doing our job.
absolutely, absolutely. If at all that there is a compassion, that's you and me. They don't give a damn about
No,
forget about that.
all they care about is their job security and their promotions to the next level.
You absolutely said it right. They're from AUSA to USA,
The
AU,
judge.
judge,
Mhm.
like all kind of things, or
Yep.
maybe some political office.
It's a fraternity. Even the judges, they're all a member of the same fraternity, and they're going to back each other. And the heck with the defendants. We're not in their fraternity.
Absolutely, my judge, district judge, Judge Afric, he's been written up in Wall Street as well as the local newspaper, NOLA.com, where he had a conflict of interest, and he was one among the many. But in Louisiana, he was the judge with the highest number of conflicts. In fact, one case they cited of an asbestos settlement, both litigants, you know, agreed for a settlement. He dismissed it. So that is the judge that I have. And I'm contesting some parts of it. So I would like to, leave that for the final disposition of it. But anyway, I just wanted to put it on the record that there's the judge, Judge Afric, who has conflict of interest recorded and reported in the NOLA.com as well as the Wall Street Journal. So coming back to my prosecutor, essentially she put a threat on my first lawyer, who's the guy that secured me $746,000 fighting with the government. And the second thing is, then there was a Physicians Against Abuse, and Dr. Black, one of the doctors that's is helping some people. They targeted her and her group, so much so that it has to be heard in the magistrate court, Judge Roby. So the Judge Roby said, Miss McHugh, the prosecutor, what is it to you if Dr. Black or anybody that Dr. Akula wants to get? What's wrong with him? He's got his choice. That's his case, and he can represent whoever he wants. I thought that was the ruling. 2 days later, it was reversed. Then I said, what happened? And, Dr. Black, everybody got, crazy, and we should know all kind of
Did the prosecution have some secret connection with the judge?
Absolutely. What happened is
My goodness.
the order of Judge Roby was very clear. It was improper for this prosecutor McHugh to call her chambers to influence the judgment and ex parte communication. It's on record in the order. It's not a little hearsay or somebody said something to somebody. On the record, how she manipulated and wanted to get my help, Dr. Black and Physicians Against Abuse. This is not the first time. She's done that with my previous lawyers. So every help that I get, that she wants to take it out. And literally, she wants me to just bow down and plead guilty because that's easy for them.
That's what it is.
That's exactly what. In fact, as a matter of fact, one of my lawyers, as a matter of fact, I had an air flood and I passed out. And then, I had to call 911 and later on had an ablation at the Mayo Clinic. And so he saw that as an excuse and he said, Doc, you know what? That prosecutor is going to get pissed off. You're trying to drag this, forever. Why don't you just go ahead and plead guilty? And I'm going to try to get you a little something like a little probation or maybe a small little. I said, what? Have you seen the discovery? Why am I guilty? What am I, pleading for? No. They're so powerful. They're going to twist around and do whatever it takes to just.
And we got to stop that. That's what we've got to stop. We got to stop the fact that they can do whatever it takes.
Absolutely.
That is criminal.
Absolutely. And they slice and dice, like 6 patients. They put them in like all of this thing, all 6 patients, total value is 114,000 of my indictment. 15 of them are each indictments of $100 to $200. For each count, you're going to put me 10 years in prison for $102 or $200 claims. And just imagine in the hospice. First of all, I wanted to make it very clear. I'm an infectious disease doctor. Hospice is not my practice. It is the Ochsner doctors that are admitting, taking care of this patient, discharging. It is their doing. Whatever that they did is been billed. And for example, each count, like let's say $102 count. If a patient did not die a day sooner, it's not my fault. It's not the Ochsner doctor's fault. God makes the decision.
Right.
So you're going to put me in 10 years just for one count? I mean, one day the patient lasted a little longer. You're going to put me. So this is the 15 counts like that, $100 to $200 counts. And so all patients together is 6 patients. That's all.
So
Out of the
basically,
thousands and thousands of patients, they got 6 patients to point a finger at me.
so what do you think the government is doing here? Do you think they're telling hospice people, look, if your patients are lasting close, as they get close to that 6-month time frame, that you can only have it be in hospice for 6 months, are you supposed to kill them off? Is that the message here?
Absolutely. I guess they want to have the patients be dead. They don't want them to live. In fact,
and if they're not dead, they're going to get their money back from the owner.
And they're going to throw the blame on the pain medicine doctors and say, yeah, you gave the pain medicine, the patient died. They're going to get the doctors in one way or the other. If the patients live longer, then you get them. And if the patients died, well, you gave the pain medicine and they killed them. There you go. You're damn if you don't, and if
yeah. And you don't look, I'm sorry, Dr. Akula, but you do not look like the type of doctor that would have his secret messages to his staff on 5 months, 29 days, start automatic euthanasia.
I leave it to the God, because I think, God is so merciful and gracious, and I'm so proud and thankful for the life and liberty that I have right now. And I enjoy every bit of it. I would never, ever do anything that would disappoint my maker. And all I'm asking is to make sure that I go in there and meet my maker. I'm going to ask him, have I fulfilled your expectation? That's all.
Amen.
And I'm not asking anything more than that. And all this money is not something I'm going to carry.
You can't take it with you, can you?
Absolutely. Absolutely. So in the same rounds where they have this massive audits between 2013 to 2017, 4 years, we look back as to how much of the indigent care we did. $1.5 million worth of indigent care we did, Cannon Hospice did. So we were taking care of it. In fact, as a matter of fact, there used to be an old hospital called Charity Hospital. In a charity hospital, if there is an indigent hospice patient, they would pick up the phone and call Cannon Hospice, because we were the one always
would take care of them.
Absolutely. That's exactly was my dream. When I set up a foundation in 1994, my dream was to care for this community. In fact, I came with $50. Everything else is not mine. It belongs to these people. I want to give them back. But the government, with what it's doing, they're not only trying to name and shame, they want to take it away of my service to this community. Eventually, the person that's suffering is our patients, our community, and our country.
I have one other question for you. Should something happen that, and heaven forbid that it does, but would Cannon Hospice be absorbed, you might say, into a hospital-owned type hospice situation that might be a competitor of yours that maybe the government would rather see in control of the population in your area? I mean, because that's what I see in most of the places in the United States is independent physicians are attacked so that hospital-owned competitors can take over. Is that a case in your case?
In fact, there's been a lot of competition that's actually trying to do any and every way to just give it away. In fact, as a matter of fact, when I got divorced, my ex-wife was a nurse. She evidently was called in by the owner of my competition Passages Hospice. And evidently they had a meeting. And Chris McMahon, that's the guy's name. So he had a meeting and said, hey, listen, how can we put this guy in jail? So basically his intention was, if I go to jail, then he can have it, for peanuts or whatever. And so, and I asked, some of the lawyers, oh my God, that's the investigation, FBI 101. That's the way they do it, because they don't want these investigations to be cumbersome and complicated and, a lot of cost involved. They go after, especially if you are divorced, that's the first thing you do. You go to the spouse, and obviously the spouse would be mad and angry and other stuff. She would just come join in, and you'll easily, be directed to jail. That's exactly what is the trick that they play. They try to play with that. In fact, some of the ex-employees, which I don't know who is the witness and who is not, because thing is, under the Jenks Act, which I believe is by, if there is a mob boss that's involved in the criminal case, the victims or the witnesses need to be protected. That's the kind of clause that they use in this Jenks Act. They're trying to use in my case, as if, to
You're
tell
a
you,
mob boss. Yeah. Or you're a
this
danger to the witnesses. That's ridiculous.
is the rogue elements of the government. It is the mob elements of the government that's trying to attack me, and then try to do a conspiracy with the attorney general. And I'm going to explain it because it's very, very important.
Okay.
They gave, ever since this indictment happened, they started, reaching all these disgruntled employees. And I don't know how many of them are witnesses, and because I have no idea right now. One of them for sure is a witness and all stuff. They started spreading rumors. Oh, Dr. Akula is going to go to jail, and this Dr. Rachel Murphy was saying, oh, if I put some money, I want to be a part owner and I want to take over the medical directorship. There's another one that said, oh, you're going to file bankruptcy. All your employees are going to walk away and all this stuff. And so all these rumors have been spread around. And guess what? So a whole bunch of them started doing a payroll scam, putting some double payment, putting some phantom employees and getting paid, getting overtime,
Wow.
all these things. And that are being investigated by the Louisiana Attorney General.
Sounds to me though, I mean, not to, I don't really know your case, but to me, it's almost like they've been set up by the government to do that if it's going to reflect on you. They did that in my case. The government actually broke the law using someone who, and I'm going into my details of my case, but that's what happened to me is the government actually used people to break the law so that I could be, faced with a charge. Is that a possibility there that these people that are doing all that are actually doing it under government direction?
That's a very, very likely possibility, especially right now. I have a civil suit that involves the Attorney General, all this investigation, and the prosecutor, and everybody. And so this scheme is not just nickel and dime.
Yeah.
Last year, Dr. Black, who was involved, in trying to oversee and see exactly what's going on with this investigation, it was brought to her attention. It was already $300,000 scam. And they were almost ready to have some arrest warrants. That was like 8-10 months ago. Nothing has happened.
Okay.
So there is
they're keeping those, I can basically tell you, they're keeping those people under threat of, we will charge you with this crime, but if you testify against Dr. Akula, we'll erase the charges.
Absolutely.
That's happening everywhere.
Absolutely. You know, it is not.
Unbelievable. There is not a single witness. There was not a single witness in my trial that actually told the truth. Every single witness the government put on the witness stand lied because they told what the government, they said what the government wanted them to say. That is
In
what the
fact,
government does. We got to
absolutely.
stop this. But I didn't mean to interrupt. I'm sorry. It's just making me furious to hear what they're doing to you.
I see I can sense I can see the radiation of your pain.
Yeah.
So,
The fire is coming off.
so just imagine that this is not just a little scheme where, somebody's saying something. As a matter of fact, one of the screamer ex-employee started make some payments as a part of restitution. So she's guilty by giving her a check back. And
Yes.
I was told, if you cash it, it's going to be civil. So I'm stacking up
Stacking
with
them.
so far $30,000 worth of checks have been written
Oh,
back.
jeez.
Clearly shows that somebody is guilty. They're saying I'm guilty. Nothing has happened. 1.5 years.
Yeah.
And did you realize that no Jeff Landry, who's the Attorney General of Louisiana, he is contesting for the governor. Is
Oh,
coming.
yeah. Oh, it's a revolving wheel.
Absolutely.
The attorney general in my first case wanted to be a judge. So he brought additional charges against me to make him look good.
Absolutely.
He didn't become a judge.
He's supposed to,
He's
be he's
he's actually a defending attorney now. He's actually defending doctors against the government instead of because he didn't make it as an attorney general. It's ridiculous. Like I said, it's all just one big happy fraternity.
and then he's supposed to be protecting as a Republican, all these small businesses. What about us? We are a small business. And you have people that are doing a payroll scam not to just bring this company down, and you still sitting on it and you're working with the prosecutor to try to play these games on me. And that's exactly is the problem right here. This is like Louisiana is like a swamp. Get me out of here. I'm getting drowned.
Well, it's going on all over there's no safe state in the nation.
Absolutely. Absolutely.
DOJ is completely out of control. They have really gone rogue, and we as a country have got to do something about it.
Absolutely. Absolutely.
So wind up. I don't know. I didn't mean to interrupt. If there's anything more about the situation, wind that up because I do want to spend the last bit of our interview on the solution, what we can do about it, what the country needs to do about it.
Indictment, no, indictment itself is the mother of all lies, is that Dr. Akula told his employees to, bill higher.
Overcharge. Yeah.
Absolutely. That's the biggest lie that there is. And the second thing is, oh yeah, he admitted the patients that don't belong in a hospice. Hello, I am not the hospice doctor. It's happened to be that I'm the owner, that is infectious disease doctor, but the doctors that are serving as a hospice doctors are Ashner doctors. Nothing has been done against them.
I was going to ask you if any of them have been charged.
No.
No. Okay.
In fact, as a matter of fact,
they probably haven't been charged because they've been offered the chance to be a witness.
But
if they don't do their part as being a witness, then they will be charged. We'll just watch the future. I'll see who the doctors are that were working for you and if they're charged in the future. Yep.
Just listen to this very carefully. What happened is I filed a suit to make sure the judge in the parish court, I filed a suit saying that I think, these doctors are the doctors that admitted, should have discharged or whatever that, they're alleging, it belongs to them. Guess what? The judge said, agreed with me that this Ashner and their doctors may be involved in the billing fraud, so she does not want to dismiss it. So she wanted a trial on that. Could you imagine where a judge in another court is saying, yes, these are the people that are involved in the billing fraud. On the federal court, they're going after me. And the other judge is saying, no, here is the doctors that are involved. You need to go after them. And that's what I'm going to try. That's where is the dichotomy. It is called as selective prosecution, where you target the black and the brown doctors. In the last 12 years, evidently in the Eastern District, there's about, like a 9 or 10, whatever number of doctors that have been either indicted, convicted, whatnot. Maybe one or two of them are, you know,
Caucasian.
non-black. Yes, all of them are either black or brown from India or Pakistan. That is the record of this Eastern District in New Orleans. So that's something I think, I'd like to see some
Exposed.
resolution.
Yeah.
It definitely has to be exposed
Yes.
on a bigger scale.
And so for the people that are listening to this, Dr. Akula, what would you say would be the solution? How do we need to turn this around so that these attacks on compassionate, good doctors stop?
Absolutely. I think it's very, very important that, first of all, the doctors need to get a courage. They need to join doctors of courage to fight the government. Because what happens is a lot of doctors that made it good, great families, children, blah, blah, blah. When they get threatened, they say, oh, what am I going to do? I said, oh, you know what? We're going to give a little probation. But what? We're going to take your license, we're going to take your assets and all this stuff, and you're going to be walking around saying that you're a felon, convicted felon. Doctors need to stop doing that. Show me your evidence. I'm going to fight it. I may lose the money, but I'm going to lose it fighting it. Not just give it away. That's the number one thing that needs to happen. I don't believe the doctors, they get afraid. And there's quite a few doctors that, come across, they plead guilty. In fact, they try to do that to me. I said, hell no, I'm going to fight it.
Well, especially since most of the doctors have all their assets taken from them, frozen, taken from them before. They don't have the money to hire a lawyer. And so they're given a public pretender is what I call them. And the public pretender or public defender is the correct term, but I call them public pretenders because that's what they are. And they basically are paid extra. They get actually bonuses for every plea agreement because it saves the court's money.
Absolutely.
So they get paid extra for a plea agreement. So naturally they're going to talk their doctors and their clientele into pleading. And so that's most all that, and they don't do anything to prepare for the case. So, at the end they finally say, well, I'm really not really prepared because they figured they was going to talk to their doctor into a plea agreement. And it's a lost cause. Plus then the doctors have no money to really fight it in most cases. So we end up losing.
Exactly.
Yeah, go ahead.
This exactly happened with my case. This last lawyer, I paid $250,000. He was sitting on this, not getting the discovery and all this stuff for 8 months. I said, hey, I want the discovery. And I also wanted to see if there is any conflict. Have you checked out the financial conflicts of the judge? Because I'm going through it's a life and death matter for me. Have you done that? He immediately withdraws and he's putting all that money in his pocket right now.
Yeah.
He's done hardly anything. And I was the one that got all the discovery afterwards. He'd filed 3 motions to enroll, motions to continue, motion to withdraw. I filed at least 20, 30 motions afterwards as a pro se.
Yeah.
So, and then it's very, very important. The families need to be strong because the families get so harassed. My son, who was in the military, when my mother passed away in India, as you know, that in a Hindu tradition, the body and mind is 5-element composition. So by cremation, it is intended to return those 5 elements of this body and mind back to the nature, and the soul travels to another life or whatever. And it was my spiritual duty to lit the funeral pyre, and I was denied that. So as a symbolic representation, my family in India is suing with 1 rupee. 1 rupee. Just like, you charge only $1 register, enroll a membership into the Doctors of Courage. They're charging 1 rupee, which is almost like a 10 cents. But just to show, because they were so upset. Their grandson, my son, who is in the US military, stationed in San Antonio, around the time when my mother died, his bank account was frozen. He had 3 babies. He called me crying, Dad, I can't bring a food to the table. I said, what? You're a captain, you're an officer. What happened? Did you go talk to the bank, to the Capital One? He said, yes, Dad. But they're saying investigation, the criminal investigation. You know, the young
They're just after money, I tell you. That's terrible.
criminal investigation in a military men's court martial. He was scared, petrified.
Yeah.
Could you imagine how they try to harass the families?
Yeah.
So the families need to be strong too, to be caring. Otherwise, we won't be able to fight this monster. These are rogue elements of the government, the mob elements of the government. And they want to use that mob, Jenks Act against me. Hello, who is the mob boss? You or me?
Well, the government, I mean, American people didn't used to be this way. American people, and I'm sure when you first came to this country, you saw that we actually had ethics and morals. Those ethics and morals have disappeared. And the problem is, back when the laws were created that gave government agents immunity, there was ethics and morals. But the fact that we don't have any anymore, now the government agents can do whatever they please, and they're immune from prosecution. I don't know if you know it or not, but I actually spent time in prison. Okay. And while I was in prison, the prison guards would break the law. They'd be out there in the middle of the complex smoking away and all this stuff. And I would point out to them, and also they'd break the law as far as doing the things that the law says they were supposed to do for inmates. And I would point out their law breaking to them, and they would literally, well, sue me.
You see that?
They have the government agents don't care because they have immunity. Okay, so we've got to remove immunity from people who break the law. It doesn't matter if they're a government agent or if they're anybody, anywhere. If a person breaks the law, they should pay the price. And we've got to get that understood through Congress to remove these laws that give people the right to do whatever they please simply because they can.
There is a legacy of whatever you do, nothing happens. I'm going to just give a capsule summary of a Tuskegee experiment. Back in 70s, it ended.
Yeah.
For 40 years, the longest human experimentation, where these people have been lied. Poor Black people have been lied. We're going to treat you. They should have been given penicillin, but they did not. They were given a little bit of vitamins, little tonics and all this stuff, make them believe like, they're being treated for this bad blood disease. So it's all lie after lie. Did you realize at the end of the day, these guys got instructions, written instructions for all the doctors, all the patients, 623 of them, circulated among the clinics. If anybody got their name, in there, they will not be treated because they were afraid. And not only that, when this whole thing ended, around that time, Nuremberg trial, like in Europe, where the Nazi, doctors and all those war criminals are being persecuted, tried, American president sends a judge over there. I want an American judge over there for the trial and all this kind of stuff. Guess what? They hang like more than 5 doctors, Nazi doctors, for similar crimes that they have done right here. 623 people, Black people, died of the same experimentation that they have done. But the Nazi doctors have done it.
Yeah.
None of them got punished. And in fact, the head nurse, Nurse Rivers, was given a meritorious award. That's the kind of legacy that we got. So it's going to take a long time. It's going to have a significant impact. We all come together and fight it. And then they will try to dehumanize, get you emotionally so broken down that you give up. You want an easy way. You want to just get plead. That's the problem with the doctors.
Mhm.
And then we need to stop that.
And all the doctors that have been attacked, the work I've been doing for the last couple of weeks is I've been going back over my records of the over 2,000 doctors that I have on record that have been attacked. Of that 2,000, over 1,000 of them have been in prison. And I did
Wow.
not realize it was that many, but over 1,000 of them have been in prison. 200 are currently in prison. So 800 doctors have been in prison and have been released. Do we see those doctors doing anything? Absolutely not. There are very few. There are a few. Okay. But most of them have just disappeared. And so what I'm going to be doing is putting out on Doctors of Courage. I'm going to put a list of these doctors that have been incarcerated and are now currently out. And even those that are in prison, I might even put those names out there. And I'm hoping that people will actually locate these doctors in their area. I'll put the area that they were incarcerated in. I can't really know where they might be now because they might have moved. But I'm going to put this list of doctors' names out there. And I want people to try to communicate with them and say, Doc, why are you sitting back there doing nothing? Why are you allowing this to continue to happen to your other colleagues? You need to join the fight and see if we can't get more doctors that this has happened to.
Absolutely.
I mean, I understand post-traumatic stress, but there's homeopathic solutions for that. I know I took Arnica Montana when I got out of prison. I have not had any post-traumatic stress or any, bad memories or anything. I'm completely washed of the stress of having had the attacks on me. So there are ways of people to avoid that if they just simply, use good medicine to when I can say good medicine, I'm talking alternatives, not conventional. Sorry, if but I mean you've had experience with some alternative medicine, I'm sure, with Ayurvedic medicine and so on, and whether or not it works in every case. I'm not that familiar with Ayurvedic medicine, so I can't speak to that. But homeopathic medicine I am familiar with, and it really does work. So if doctors are suffering from the stress of what happened to them, there's a solution, and hopefully they'll come and join and learn. My plan is for people to learn first off. There's I offer e-courses, and I have an initial e-course that everybody needs to take, and then hopefully if I can get more doctors involved, I will have a second e-course that will help teach doctors how to protect themselves so that it won't happen to them what's happening to you, what happened to me, and so on. So that's my goal, to be able to do that. So any
All right.
final words? Any final words for the folks that are listening?
I think, I would like to thank, Doctors of Courage and for listening to my story. And I want the doctors, especially when they're attacked, they need to stay strong. They need to chill out, think about exactly what's happening. What is the evidence that they have against them? Rather than just try to go for a quick fix. And that is really not going to help. And it's going to perpetuate the sickness, they're spreading, around the country. Just, you cut a deal and we're in the like a 99% thing of people plea deals and all this stuff without even looking at their own discovery. And that's not going to help. It's going to continue this sickness. So we, need to be strong and to be united and be together. And our families need to stay close together and be supportive of what, their breadwinners are going through. It's very important. It's a struggle, and it can only happen when all of us get united. And there are other organizations that doing little bits and pieces in the same area like we are doing. Some of them are civil rights organizations, some of them are another doctors organization, whatever. It's a time for us to all unite together.
Get together.
Yes,
Would you
that's my recommendation.
would you say that we need to revamp the Medicare guidelines and rules? Because in my opinion, and actually a person who was in the government when Medicare was created, I have a somewhere in my notes way back. He actually said that they were creating Medicare with the rules and guidelines that doctors would not sign up, that they would be so complicated that doctors would not sign up. Obviously, the government did not want elderly people to be, taken care of. And so they did create these, terrible rules and guidelines and so on. And of course, they change every year, as you know, so that you're never sure if you're really going to be following the guidelines or not. And that's all, to me, just tricks so that they can charge us with fraud, because they get back 5 times more money than you actually paid them for your services, than they paid you for your services. So I think we need to point this out to folks. We need to either revamp the Medicare guidelines, or the other thing is, if a person is going to be committing a crime, hopefully this Supreme Court decision with Ruan and Khan
Absolutely.
has shown that there needs to be mens rea. There needs to be an intent to commit a crime. So in the case of Medicare law, what we need is, if a person is doing something wrong, Medicare is charging them with fraud for doing something. First off, has Medicare ever told them this is something you're doing that you can't do, to give the doctor a chance to change their methods or rules? If they're charging them straight off the bat with committing a crime that the doctor did not even know was a crime, is that really a crime? It shouldn't be, according to American justice, but it is, because of the propaganda that they've put out there now about doctors are only in it for the money. Okay. So those are 2 suggestions that I have. Revamp the rules so that they're easier to follow. And number 2, if they say a doctor is doing something wrong, first, the doctor must be informed it's wrong, and then see if he changes his ways before charging him with a criminal
I think,
act.
what I would like to do is, in terms of the same Ruan's case, I think I would like to do just like when there's a malpractice complaint, there is a panel. We could delegate the same thing with the Medicare billing issues. Instead of criminalizing, let us decriminalize and have a panel. And if they want to include, some lawyers in there, go for it. But we have a panel and review and see exactly which is the one that really, truly have committed an intent to commit a fraud.
Mhm.
And then you can actually screen quite a few of them that may have not intend to commit, and may have a way to restructure their business practices, their practices to in a way which will conform to rules and regulations. We're not corporate bosses. We're little guys,
Right.
small businesses. We need help. And instead, you make a little bit, more, then boom, you put you out of business.
Right.
And then with a threat, we're going to put you in jail. As if,
Yeah.
You cannot, imprison your soul. And that's why I think, all spiritually, all of us need to be strong. Because when you get deeper, divine self, nothing can imprison you. You are free,
You are
free to
free.
live and free to serve. That's what I say.
Okay.
Thank you.
Thank you so much. I
No problem.
appreciate it. And I'm going to just share the screen for folks here to be able to learn. This is all potentially mostly for doing away with Controlled Substance Act, as far as doctors who are being charged with prescribing opioids and other controlled substances. And this is another area. The Medicare fraud is another totally different area than the drug war, but it's still, if we can end one, then we can work on the second one. Medicare fraud is a much bigger, more encompassing subject, and in fact going to affect a whole lot more doctors. But again, just like with the Controlled Substance Act and the attacks on innocent doctors there, most of the doctors charged with Medicare fraud are innocent of wanting or trying to commit a criminal act, and that needs to be stopped as well. So I appreciate those people that are listening, and I thank you, Dr. Akula, for coming on and discussing what's going on in your case. And hopefully we'll be able to get some of this collusion and some of this government misconduct to end, or at least be recognized for what it is. And hopefully people can learn from it and come learn as to how to protect themselves. So thank you again for coming on board and giving us a chance to get to know you.
Thank you,
Appreciate
Dr.
it. Okay.